Good morning, everybody, and hello and welcome to our webinar on doctors' mental health and well-being, which is in support of CrazySocks4Docs, where we're actually putting the spotlight back onto doctors' mental health. My name is John Mannion. I'm the Executive Director for Breakthrough Mental Health Research Foundation, and we have great pleasure in supporting the development of the webinar today in partnership with our colleagues with SASMOA and Doctors in Health SA. Today, we're actually joined by a number of leading South Australian medical representation. We have Professor Michael Bagent from Flinders University and from Southern Adelaide Local Health Network Mental Health Services. And there's also we have the knowledge of being a board member for Beyond Blue for a number of years. So welcome this morning, Michael.
Thank you.
We are also joined by David Pope, the president of SASMOA. Morning, David.
Good morning.
Dr. Di Lawrence, the Executive Director of Medical Services at Southern Adelaide Local Health Network and based at Flinders Medical Centre. Good morning, Di.
Thanks, John. Pleasure to be here.
Great. Also joined by Dr. Roger Sexton, who is the Medical Director for Doctors Health in SA. Good morning, Roger.
Morning, John.
Dr. Emily Kirkpatrick, who is the Medical Advisor for Primary Care.
Good morning, John.
Good morning. And last but no means least, Dr. Kate Howell, GP, therapist, educator and author, and also the medical education consultant for AMP Heat. Hi, Kate.
Hi, John. Morning.
Good morning. Thank you very much, guys, for joining us today and wanting to obviously share your vast knowledge to support this really, really powerful conversation about mental health in doctors. The inaugural campaign for Doctors in Health, the CrazySocks4Docs, began in 2017 by Dr. Jeffrey Toogood, who's a cardiologist. And he's been championing the mental health conversation now after experiencing his own personal battle with mental health challenges. Upon wearing sort of odd socks one day at work, he realised it actually triggered a bit of a conversation. People he felt were talking behind his back, and he felt that this had become a trigger. The reality actually was that it was his own dog had run off with one of his socks in the morning, so he ended up putting an odd pair of socks on him. But it struck him that this became a really, really good focal point to have that mental health conversation, the opportunity to challenge the stigma and discrimination that's often associated with people acknowledging that they're suffering themselves. And especially if you're a person in an authoritarian position, so a person that's a doctor, were we able to actually acknowledge we're struggling ourselves? And he realised that this was a really, really powerful tool for him. The actual initiative now has become a global movement. The start of the last Friday or the first Friday of each June, people start to raise awareness on the mental health and stigma that's actually associated by wearing odd socks. It starts that conversation, and Jeffrey this year started the Crazy Socks campaign with an incredible webinar with a vast array of expertise, starting to talk further about the positive impacts we can start to have within our own profession. Jeffrey's mantra itself is to raise awareness. He wants to normalise the discussion about mental health, and he wants to create a safe environment in which we can actually do this. And he believes that it's actually part of the leadership's responsibility because culture is driven from the top. So we're really, really thankful for Jeff, the bravery to actually stand up in your own profession and say you're struggling, and to drive that mental health conversation. He wants to make that part of the everyday vocabulary, and today's webinar is to continue that work that he's been driving. So the Crazy Socks campaign has never been more poignant as it is presently now, especially after everything we've faced in our community following the sort of COVID-19. Doctors suffer a wide range of complexity within their work roles, but also within their own mental health. Challenges with anxiety, depression, burnout, fear, the unknown. So it's never been more relevant for us to actually have this mental health conversation. Breakthrough Mental Health Research Foundation have partnered then with SASMOA and also Doctors Health to actually bring the webinar for you today. We've been wanting to raise the awareness about mental health throughout the whole of June. So not just to have that one conversation, that trigger point, but also actually to drive a further conversation. But we actually couldn't have done this without all our support and all our partners. And the partnerships have been really, really powerful for us. We've got a number on the screen behind us to say thank you. But if we look at our gold sponsors, we've had support from Southern Adelaide Local Health Network, from Flinders University and the Rarama Institute, from Adelaide Primary Health Network, and also from MIGA. And presently our fundraising tally stands at over $32,000, which has been incredible this year. And that's through sales of socks, through donations and through those sponsorships. So we're really, really grateful for that. This year's funds then we're going to reinvest back into further seed funded grants, and we're wanting to actually look later in the year of doing a project with Flinders University to start to actually look at further research related to doctors' mental health, but starting to look at the positive impacts we can actually have. So we're really grateful for everyone that's been involved with us today. We know that mental health doesn't discriminate. It doesn't matter what our role is. It doesn't matter what our job is or where we actually presently sit. And we know that our medical profession are not sort of prone not to have mental health challenges as well. In fact, 1 in 5 medical students have reported suicidal ideation in the last 12 months, with female doctors at 2.27 times more at risk than general population. So we know that these statistics are really, really powerful. We know that we need to put strategies in place, and we want to do something about that. Last year, we funded some research through Professor Paul Ward at Flinders University, and he started to look at a piece of research to start to look at the impact that mental health was actually having in our medical profession. He wanted to explore about the professional culture, organisational climate, and also the health service context and where that sits and fits. He's wanting to really try and trigger and identify what were some of the structural contributions to doctors' health, what were some of the experiences doctors were feeling, and what were sort of the risk factors that were actually put into place. And that research at the moment then has identified some higher risk groups. So those higher risk groups are looking at females, the younger medical profession, and also some specific specialities. And then he's looking at then what are the lower risk groups and what's the difference between those two groups. The work at the moment now is waiting to do some further interviews and do some shadowing. And unfortunately, due to COVID, the shadowing part has had to be put on hold. So he's slightly behind in where he would like to be, but hopefully by this time next year, we'll be able to provide further feedback. But what he's aiming for is to get really positive impacts. How do we actually change our strategies to actually support our medical staff? How do we measure and monitor the mental health promotion and suicide risk? How do we inform national policy? How do we put better treatments and support mechanisms in place? How do we ensure we get equity across a wide range of our medical team? And how do we actually improve our organisational and professional culture? All of which we'd all agree would be great sort of transitions to move forward. So for ourselves, this has been the sort of the end of a month's campaign. We've wanted to wrap up that month with actually having the webinar with all this expertise and really getting to some more further in-depth conversations. So really, I want to really dig into that now. And obviously, I've got a number of questions which we're going to share. And obviously, the first questions we'd like to ask are over to Professor Michael Bagent. So Michael, if we could start with you, what is research telling us at the moment in regards to mental health and doctors?
Well, in Australia, I think the best and the biggest research has been done with Beyond Blue research that was done, the National Mental Health Survey of doctors and medical students. It was done in 2013 and sampled about 11,000 doctors. And the outcomes really showed that, in summary, that doctors had more symptoms of mental health problems than the general population. I'll just delve down into that in a little bit more detail. When we looked at burnout, a third of doctors scored significantly on 2 of the 3 measures for burnout, indicating that they had significant and high rates of burnout. And the rates of burnout were highest in the junior doctors and diminished as you became more senior, and were higher in females compared to males. When we looked at, if you're looking at the K10, many doctors are familiar with the K10, it's a non-specific measure of mental health symptoms. We find that doctors score a little bit higher than the general population, but the highest scores are found once again in females and in younger doctors. And the higher rates, if you delve down further in detail at it, the higher rates are found amongst those who were single or widowed, who worked more than 50 hours a week, and who had, interestingly, no children. If we look at the source of the stresses from the research, what we learned was that doctors reported that imbalance between work and family was the major source of stress for them, or too much work was the second stress, and having too much responsibility in too longer hours was another high-ranking stressor for them. If you're looking at diagnoses, doctors self-report being diagnosed with depression at slightly greater rates than the general population, and anxiety disorders similarly are reported at slightly higher rates than the general population. Only a little bit higher, and I think we're probably better at diagnosing it ourselves than the general population are, so maybe that accounts for it. But the big concerning thing is suicide, and if you look at the rates of suicidal ideation amongst doctors in the last 12 months, about 10% have thought about ending their life, and that's quite similar to the general population. But if you look at, and the rates were higher in those who had high scores for burnout and who scored high on the psychological symptom measures. But the real concerning thing is something you alluded to, and that's the rates of suicide. The rates of suicide amongst female doctors is double that of the general population. And that is, that is a big concern, a startling difference. Looking at the flip side of things, if you look at resilience, I think you'd have to agree that generally people who are doctors are a resilient bunch. We are. And it's reflected a little bit in some of the research findings from that survey. And that is that although the symptom rates are high, few reported that it caused significant impact, as much impact as you would expect on their work performance. So it suggests a degree of resilience. And the good thing is that doctors are quite ready to go and seek help. Although they mightn't find it easy, they are generally ready. But so overall, I've got to say that high symptom score measures amongst doctors, not necessarily higher illness, greater readiness to get treatment, which is great. But the really concerning groups are the female doctors and the young doctors. So that'd be the summary of it.
Okay, thanks, Mike. Michael, you referred to the context of burnout. Do you want to explain what that is? Because obviously it's quite open to interpretation, isn't it?
Yeah, well, burnout's generally described as three components to it. There's the first level is emotional exhaustion. Physically and emotionally exhausted, too much to do, too much work is caused by too much work generally. The second bit is cynicism, become quite cynical about patients, the health system you're operating in. And then the third bit is almost like a self-protective thing. Well, I'm not really good at what I do. I'm not really effective. I'm not making a difference anyway. And it's kind of at the end of the line defeated point of view. There are measures that we use to measure, to rank and score those, and cut-off marks that suggest we look at for high levels.
Right, thanks, Michael. And Michael, why are we then finding that well-being is so important within the medical group?
Look, I mean, we've got to be well to look after our patients, don't we? We've got to be well so that our patients feel comfortable coming to seek treatment, and we can look after the population. That's our job and role, is what we're trained for. And doctors need to feel as though what they're doing makes a difference, and to feel good about what they're doing. We are in a fortunate position to begin with. We're by and large well paid. Our position is still held well in the community, and it still can be a lot of fun. It's tragic when it's not, and when things get on top of people and they're not looking after their own well-being. So we really want, well, I mean, the message is very clear. We want people to seek help when they need it. We want people to adjust their work practices to ensure that well-being is maintained.
That's great. Thanks, Michael. Leads beautifully into asking David a couple of questions. David, obviously, from a perspective, sort of connects and represents that sort of medical community. What have they been telling you how they're feeling at the moment? Obviously, the pandemic's had a massive impact on their workload. So what sort of supports have been raised for you?
Well, as you can imagine, they're describing much of what Michael outlined, actually, that they're having difficulty achieving work-life balance, that access to leave is a problem, that rostering is often quite draconian and abusive in some situations. So it's a matter of them feeling, worn out, tired, very fatigued, and often quite angry about the way that they're treated and they're managed, both at a system-wide organisational level and even sometimes at a unit level, where that's less common. And I have to say that there's quite a difference between sites. So in the union, we notice that certain sites raise much more of these issues than others, and I think looking at that, that is reflective of the skill of the senior managers at those sites. You can certainly tell when managers are struggling to do their job properly, then that means the junior staff, especially the juniors and especially female staff, struggle with just getting reasonable rosters so that they can actually go about their normal lives.
Right, and so has there sort of been increased added pressures and stress brought on by the pandemic?
Certainly, there's been a lot of concern about people's safety at work. A lot of anger and concern about their lives essentially being put at risk, in that in some sites they're not feeling adequately supported and protected. So even basic work health and safety functions that our hospitals by law have to comply with aren't being met, and of course that gets noticed by doctors, and it's raised, and it causes enormous concern and unnecessary anger and concern when those issues, through good leadership, could easily be dealt with.
Okay, and the leadership part's vitally important, isn't it? So how do you feel then that doctors can support each other when they realise that either they're not coping or one of their colleagues is not coping?
Well, I think talking to each other is the most important, and often acting in a collective way. So this is where an organisation like a union is particularly useful in this regard, because it can mean that people who can feel isolated, bullied, harassed into not raising concerns, through acting together as a collective, can bring those matters forward in a much safer and a much less threatening way. So that allows people to get these issues properly addressed, get some professional help, either personal support, SASMO as well, linked into doctors' health type organisations and welfare for people, as well as acting as a group to address the matters that need to be addressed.
Okay, that's great. Thanks, David. It again leads beautifully into sort of asking Dr. Di Lawrence down at Southern Adelaide Local Health Network about that leadership role. Di, as a paediatrician, you're focusing on patients and families' well-being, but now as the sort of executive director for the medical services at Flinders, you still impose that sort of, not impose, but instill that sort of strong well-being and caring component for your staff team. Why has that become such a priority for you?
Thank you, John. And look, it's really a pleasure to be here, and hello to everybody. And I think, as you've stated, those that know me know that I'm absolutely passionate about this subject. I've been the Chief Medical Officer here for 18 months, and even before that, the team that works under me as a paediatrician. I'm an active clinician still. I look after sick children in our paediatric ward. And actually, interestingly, as we speak, I was supposed to be in Stanford in the USA doing a week-long physician wellbeing course, which I applied for a year ago and jumped through many hoops to get into, because I am so passionate about it. And why is it important? Because certainly in Southern Adelaide, I have an absolute responsibility as a health leader, and I'm privileged to be a health leader. I have a responsibility for the wellbeing of the staff that come onto this site, and particularly all the medical staff, but particularly the junior doctors and the doctors in training. I want them to have a really positive experience here at Southern Adelaide. They know that I care about their wellbeing. I care about their working hours. They know absolutely where we stand. I meet with them regularly. I've got a great team of registrars mentors that meet with them, and so we touch base with them very often about their wellbeing, and I want us at Southern Adelaide to be an employer of choice. I want them to choose to come here because they know that they will actually be looked after and have a positive experience. And look, you know, as Michael said, I mean, I'm a female doctor. I've just emerged from raising 3 children. I've got 3 young adults, and I've absolutely been through the challenges of juggling all of that, and I know what it's like, and I think that gives me some credibility and some clout in some ways. I think I am pretty resilient. It's certainly, I've had to learn my own strategies around how to look after my own well-being. My friends would smile at me and say, Di, it's a work in progress, because my job is, it brings all those things that make us more vulnerable to burnout, you know, the working hours, a big job that's unmanageable at times. I'm an active clinician, so need strategies in our toolkit to look after our own well-being, and there are very good resources out there, as well as being able to access appropriately, you know, support when you really need it. For example, a couple of years ago, I did the Doctors Health Building Resilience in Medicine course, which was a one-day course, absolutely fabulous. I've done Maura Kenny's Mindfulness for Doctors course. I bushwalk, you know, have really had to actually timetable and actively seek strategies to really make sure that I look after my well-being, because if you think it's just going to happen automatically, it doesn't. So the nature of the work we do, as you alluded to, John and Michael, makes us more vulnerable, and therefore I think we actually have an obligation to ourselves to look after our well-being. But importantly, the culture of organisations has to be right, and that's where I can play a role as a leader in Southern Adelaide to ensure that that culture is absolutely right and is on the improve.
That's brilliant, Di. And you mentioned there the importance of the skills you've developed yourself. But how do you actually encourage that within your own workforce? So what resources are actually available for your junior clinicians?
So we let them know absolutely on day one what resources are available. Number one, we absolutely say to them, you must have your own GP. It's really interesting, even though we say that to them, we find through the year that sometimes they haven't gone and actually done that. So, and we want them, you know, we talk about, you know, you get your car serviced once a year, you absolutely have to see your GP, even if you're well, to actually check that you're okay. You don't wait for something to actually go wrong. You know, you need to have regular touch points with the GP. We've certainly in the public system, in the government, have got access to EAP. We let them know, you know, assistance confidential that they can access at times, and we offer that particularly as we know different members of our team have had difficult things happen or, you know, dealt with difficult cases. And Doctors Health, we give them all the information at their orientation about how they access various supports. They all get allocated mentors, particularly our interns, that they can meet with that aren't part of their clinical team that they're working in. So the TMO unit similarly can provide some support to them.
That's great, Di. Thank you. You mentioned Doctors Health, and obviously we've got Roger joining us today, and links nicely into you, Roger. And what has been some of the lessons that we've actually learned from the pandemic about how we should actually start to look after our doctors? And are there any specific focuses or focus areas we need to look at that help us move forward?
Yeah, thanks, John. Yeah, great, Di. Great to hear what you're doing in Southern. It's tremendous. So we've been running the Doctors Health Clinic now for about 10 years. We've probably seen about 15% of the profession at some stage here. So you know, Michael's point about doctors being prepared to seek help is absolutely right. But we've learned a lot of things. I think COVID has exposed the fact that, you know, we are people. Doctors are people first. We have our own physical and mental limits. We really enjoy human contact that our work brings us, very, very common ingredient for doctors' wellbeing. But we train and work in very risky environments. We're not immune to illness. We all deserve and need to feel safe, valued and listened to at work. These are probably the three ingredients of a happy workplace. But we work under high pressure. We have our own emotions and fears. Especially, particularly for doctors, it's a fear of harming others. We take poor patient outcomes, particularly personally, and cause harming our own loved ones and families. At home has been an issue that COVID has exposed. But for a lot of doctors, they have an obsessional personality type, and this COVID has been a really important period of rapid change, adaptation and change, which has triggered anxiety in a number of doctors, having to modify their workplaces, their work practices very rapidly, almost on a daily basis, has been a source of great anxiety for doctors. So doctors who, you know, like to get on top of the detail and drill down and do things thoroughly, doctors have been much more prone to anxiety through this period. So there's been a personal and a professional impact of COVID on doctors. You know, and COVID has added effectively yet another workplace health and safety hazard to the list that already exists around needle stick injuries and exposure to trauma and burnout, fatigue and bullying, and easy access to drugs and prescription pads and referral pads. These are all things that are standard workplace health and safety issues for doctors. So what we're seeing at the clinic, certainly doctors coming here, has been the stress associated with rapid change and adaptation. The new ways of having to consult, often telehealth, has been physically and mentally exhausting. There's been new areas around medical legal risk, concern about having to practice in a different way has triggered a whole lot of anxiety around the medical legal risk of working. The other thing I think we've seen is this tremendous pipeline of information pouring into doctors from multiple sites about updates and keeping on top of things. And, you know, the response to this is sometimes just chilling out because it becomes almost overwhelming. So a sense of withdrawal from it has been quite common. Also, the emergence of new competitors and alternatives to medical care has been very interesting. And some it's been very interesting to see the internet-based services emerge, and whether they'll linger, I guess, remains to be seen. We've seen a lot of isolation and loneliness, people who've clearly not had human contact through colleagues and at work, having to deal with things remotely, and they've often suffered a sense of being isolated, and particularly our rural colleagues. We've seen the specialist training disruption, delayed exams, entry into training, cancelled surgery. All of these have been really important triggers for distress amongst our specialist training and a fear of spread to the family. There's been some positives too, you know, the innovation, drive-through clinics and telehealth, very interesting adaptations. For some, COVID has been the gap year they've always wanted. It's been a permission to step back and have a break from things, and also time to rediscover the creative side, and quite enjoying permission to do these things. So probably seen about a few things the doctors have done very well. I think stopping and taking stock from their hectic lifestyle. We all think what life used to be like before COVID. A lot of it's changed, a lot quieter socially. Focusing on the basics of food and less alcohol and physical activity, good sleep, quality and quantity. Relationships, reaffirming time with friends and family, even if that's done virtually, and fulfilling other roles in life. You know, we're all somebody's daughter and somebody's son, and often these other roles get squeezed out by medicine. So being able to do those has been really good, and particularly rediscovering non-medical interests. You know, we all need an antidote to medicine, and we live in a very highly constrained and regulated profession with evidence-based and guidelines and the medical regulation, and it's nice to lash out and do some music, art and writing and things like that. And I think a focus on workplaces and work practices has been very important. You know, work health and safety things do apply to doctors. We aren't immune from illness. And the importance of basic existence needs, you know, an army marching on its stomach. We need food and water when we're at work. So some of the focuses moving forward, I think I've seen the importance of medical checkups of doctors at this time, particularly through transitions. You know, COVID has been a transition. So having a checkup with your GP, not just a blood pressure and a hello, it's a really thorough check of lifestyle habits and the way you work, the way you practice, as well as your current and emerging risks and things. It's very important to do this on a regular basis, right from medical school, right through our career, looking at our workplaces and making sure we do feel safe, valued and listened to in those workplaces, and our work practices, having good breaks and access to food and water, quiet places to talk and relax and discuss difficult cases. And also the concept of a sabbatical or a gap year needs to come into this. A lot of doctors work for many years without a break of more than a few weeks at a time. And I think that giving ourselves permission to have a 2-3 month break and planning for that financially, I think is something we should build in. And that's something I think we've learned a lot from discussing with doctors through their contact at the clinic.
Great, Roger, thank you. Emily, a lot of these sort of points that Roger's raised there must be things that you're seeing on a day-to-day basis.
Yes, absolutely, John. So everything sort of Roger's been talking about, you've taken all my points, Roger, I was going to say. but really what we've sort of noticed at my role here at SA Health, being the primary care medical advisor and COVID-19 GP liaison, is that I have daily conversations with GPs, different specialists around how COVID has impacted their workplace, but also the significant impact COVID's had on their patients, and then the burden that then you feel as that clinician looking after that patient is just quite significant. And I think something we haven't quite taken into account really is the impact it's had on our patients, then reflected then back on ourselves as being these, you know, we're the healers, we're the fixer of problems, and yet we can't seem to fix a lot of these problems for people. And it's really quite difficult on the mental health. And one of the things Roger brought up was the impact on trainees as well. And I think that's something we really need to think about is that people's training has been delayed, exam preparation, you know, people spending 2 years studying for exams, and then all of a sudden they disappear and they've been delayed till next year. And you think, gosh, the impact of that on both their personal life, but their professional life is just so significant. So one of the things we're trying to work on here at SA Health and at SA Met is around how you can work more collaboratively between different colleges, different LHNs, and with the trainees themselves to be able to ensure that all this hard work can be sort of put into perspective and we don't delay training any further than where we're at. And the other thing really to mention here is about, we talk about frontline staff and the impact that COVID's had on that. And David, you talked about the risk with PPE as well, and that safety concern. I think we also need to consider as well that we've had huge disruption to a number of specialists from a financial perspective as well. I know that's something we don't often talk about, but that was initially when we had, you know, sudden stoppage of elective surgery. People's lives where they go to work every day, they operate, they have their usual structure, just disappeared. So that's been quite significant. And I've had a number of different specialists who have reached out to us here to say, well, what can we do? Can we go and work in primary care? Can we go and work in EDs on the front line? Because our jobs, our livelihoods have been disrupted and we want to contribute and we want to help. So I think that's something we also need to consider in our response to COVID-19 and our adaptability. So really just in summary, the things we're seeing that have been positives coming out of this has been the ability to collaborate better and sort of across the different specialties and sort of all work together and try and see how we can prioritize our own health as well in this. And so I think it's really important that we do think about that, of how we can support each other, and creating online forums, online groups where you can collaborate with your colleagues is so important, because we are missing all of those opportunities where we usually catch up for CPD events and seeing each other face to face. And we've had the stopping of grand rounds often being face to face as well. So it's really important that we think about online ways and technology and virtual means of supporting each other on the front line.
That's brilliant. Thanks very much, Emily. And finally, Kate, over to yourself. You've been a sort of an advocate for well-being in the medical community for an awful long time. What are some of the tips, the tricks, the strategies you feel we can take away from today's session?
Thanks, John. I think everyone has spoken so eloquently about the mental health issues and well-being of doctors. And if we now sort of drill down to the individual doctor, we all have to pay attention to our well-being in the same way as we do with our patients, see it in a holistic way. So paying attention to our physical health and well-being, our psychosocial, our emotional, our professional, financial, etc. So see yourself in the same way as you would caring for your patients. And it's good to be a bit deliberate about this. As Di said, she's taken a lot of action to look after her wellbeing and develop the skills. So it's useful to have a wellbeing plan for yourself. And I like a Melbourne practice, the Mind Room has a lovely simple plan. 5 things. 1 is move, 2 is connect, 3 is learn, 4 is notice, and 5 is give. So come back to number 1, move. Doctors are very much in their heads, you know, we're problem solvers, we're thinking, we're sorting out issues. Get into your body and move. It might just be walking the dog, it might be going to the gym now they're back open. But that's really important for all aspects of your wellbeing. 2, connect. And we've heard about the collaboration, we've heard about the importance of talking with colleagues, connect, and the opportunity we've had to connect more with family and friends through COVID. So connecting, we are social creatures, we need to connect. 3 is learn. I've been tutoring GPs who've been doing online courses in CBT. Huge number of courses during COVID. They've taken the opportunity to learn something new. It might be doing something that's more of a leisure-based learning or simply reading. 4 is notice. This is being mindful, and it's being mindful of your thoughts and your emotions as well. You know, we've all faced a disaster in the community with COVID, and for many doctors there's been a lot of trauma attached to their work as well, and we need to be self-aware of what we're experiencing emotionally and also notice our thoughts, because we all have a negative bias. We think more negative thoughts than positive thoughts, and not all those thoughts are truth. So we have to make effort to sometimes challenge those thoughts, particularly as doctors with high expectations of ourselves. We need to make sure we're thinking, you know, realistically and being gentle with our thoughts about ourselves and what we can do. And also bring in more optimistic thinking. A simple way of doing that is thinking about what you're grateful for in life. And that can be as frequent as once a week. It doesn't have to be all the time, just being aware of a few things that you're grateful for. Mindfulness itself, we all know the benefits of that. Doctors can bring that into their life in the everyday, whether it's when they're exercising or when they're having a shower, experiencing what they're doing with their senses and being in the moment on purpose. We can, as a GP, you know, sometimes I just shut the door and spend a couple of minutes scattered throughout the day, simply closing the eyes and being mindful. A little bit of meditation for a couple of minutes does wonders for your energy levels and dealing with stress. And give. Now, number 5 is give. So we do give a lot in our work. Maybe we need to also focus on giving to ourselves. How can we give something to ourselves, a bit of time out, a sleep in, some time away from work, etc. Or spending more time with a family or a friend or a pet. So that wellbeing plan, I love it, and I would encourage everyone to think about that. You can set a few goals under those headings and take steps towards that. And I think the other thing is, you know, review all your usual stress management strategies, and I've touched on a couple of those when talking about the wellbeing plan, things like exercise, reducing the load, mindfulness, relaxation, and so on. And don't forget about activities you enjoy, just having some fun and laughter. That's really important. And finally, despite all the challenges and the uncertainty, COVID has given us an opportunity to reflect on life and review what's important to us, and also perhaps make some discoveries about how we have been working and functioning, and maybe we need to do it a bit differently. So there's a wonderful quote by Einstein, which is, learn from yesterday, live for today, and hope for the future. And hope is about having those optimistic expectations and then putting them into action. So I would encourage everyone to take some action now around your well-being and know that we are on a very different path, but maybe there's a bit of a silver lining to what's been happening as well.
Oh, that's a wonderful summary, Kate. I love that whole concept to finish on hope. I think in our rush to go back to the new normal, which part of the normal do we wish to rush back to? And we've got an opportunity to sort of have a bit of a rain check on that. Thank you everybody for joining us this morning. The panel members have given some incredible insight, and we're really grateful for giving your time up for us today. Some of the big points to take away are the importance of reaching out, the importance of how do we utilize our leadership to promote a really safe environment, and strategies to sort of look at that. The importance to actually look after ourselves. If we don't look after ourselves, then we're not able to actually support others. So it's actually okay to take time out. It's okay to go for that walk. It's okay to go for that coffee. And joining together in collaboration, as David said, if we actually get together and look at strategies, we can actually support leadership to make really impactful changes for us. we want to thank everyone for being involved today. We also want to thank our partners. The event was actually set up in collaboration ourselves. So Breakthrough have had a collaborative partnership with SASMOA, and I want to thank Bernadette and Catherine and Tia and Jeff from SASMOA for assisting us with everything that's happened through the last month. Doctors Health, Kiara is an incredible lady. If you ever get the chance to talk to her, she will empower you to achieve absolutely anything. And then my team are here at Breakthrough for Jade, who's actually driven the project for us, with Sam, Nadine and Jonathan, who've actually helped pull it all together. What it shows is when you actually come together, you can achieve a great many things. And I think the webinar is a great example of that. And last but not least, back to Jeff. Jeffrey Toogood came up with the concept. He made it safe to start to have the conversations. He's making us have these conversations each year. I think what it actually shows is that the conversation needs to carry on for the whole year, because if we carry it on for the whole year, we can actually drive change. We can actually drive the passion that Jeff brings to the conversations, and we can actually make positive impacts. So thank you for everyone joining us today. We're really sorry we've not had the chance to answer some of the questions that have come through, but we've run out of time, which just goes to show that next year when we have our breakfast, come and join us and carry on the mental health conversation. Thanks very much, everybody. Take care.